Hello everyone. I'm very happy to be here today to talk about employment issues for people with traumatic brain injury. And I'm always happy to share my knowledge and also to share the knowledge that many others across the country and actually internationally have gathered on this very challenging topic. So let's just jump right into it. Just very briefly, I'm going to just touch on some of the research. There certainly is a whole lot out there. There are currently, it's estimated, 3.2 million people who are living with the effects of brain injury in the United States. Sadly, they also estimate that nearly half of the folks with brain injury have failed to return to work. And we're going to talk about why that is so. One study in Colorado, they used their state registry of patients who were hospitalized for traumatic brain injury. And one would assume if you're hospitalized for brain injury that it's probably a mild to severe injury. Folks with concussions or mild traumatic brain injuries are not going to be hospitalized for the most part. So these are the more severely injured folks who are living with lifelong disabilities. And their study showed that only about half of those people returned to work within the first year. In 2006, there was another study that showed that the rate falls to 20% failure to return to work at 10 years post-injury. Of course, you can look at it the other way and say, well, 80% of people do return to work. We don't know, though, how long they actually retain employment, so that's definitely a question we would want to ask. And in looking at vocational rehab services, along with that same 2006 study, vocational rehab services, the traditional vocational rehab services, assisted only about 50% of those served to achieve successful employment. And actually, I did a very brief survey a couple of years ago and asked many of the other states, you know, what is your successful closure rate in VR? And it ranged from about 30 to 60%. So the 50% figure that we're looking at really, it jives with what we discovered among many of the states that responded to my request for information. And, you know, that's not good. We can do better. We want to do better. And let's talk about some of the ways that we can do that. One of the things that came up in some of the research that I was looking at, there was a small study that looked at a 1997 sample of hospitalized TBI patients, again hospitalized, and only about 1/3 were even aware of the vocational rehab system. That certainly is an issue that we are dealing with here in Virginia. You know, one could say, well, it kind of makes sense if you're suddenly hospitalized with a brain injury. I mean, what do you know about brain injury? What do you know about services? But we are working with social workers to try and do better outreach to the hospitals to give people appropriate information. So that's one of the things that is a recommendation, that there is better outreach from the VR system, not only to people who are newly injured in the hospital, but also those with long-term injuries, folks that are chronically unemployed. One of the recommendations also was that there should be better partnering between vocational rehab and researchers to identify what is working, what works, what doesn't work, to help build a strong evidence base. I did read that there were problems with assigning people to a control group, so that's kind of a barrier. It would be very difficult to justify, well, you're not going to get these services or that we think are good, or you're not going to get these services because you're in the control group. So that's an issue we need to work out. In talking specifically about return to work strategies, one size does not fit all, and I think anybody who's worked with folks with brain injury knows that. You really need to use an individualized approach from beginning to end. And really, I'm going to talk a little bit later, there is no end for the person with a brain injury. For us and in our job, we may say, oh, we've successfully placed this person, but for the individual with a brain injury, that doesn't end. So we're going to talk about some long-term supports as well, in addition to just the work assistance. It's critically important that job placement staff have knowledge of brain injury. You really can't go into this without being educated and learning more about the effects of brain injury, the short-term effects, the long-term effects, what strategies have been shown to be very effective, and other strategies that really maybe don't work at all. So it is not a one-size-fits-all. You cannot just put people through a cookie-cutter process. The research, again, sort of summarizing, has shown that providing vocational rehab services early in the rehab process is very helpful, and that can range from doing an assessment early in the process, looking at, was the person working, what is their work history, do you think that they're going to be interested in returning to work, are they going to have to be looking at something new depending upon the severity of the injury. But the earlier that, not only VR services, I think, rehab has to be provided very early with a focus on employment, on returning people to work. That should always be your ultimate goal, if the person so desires, of course. Create a supportive work environment. That seems to be, kind of a given, of course, for any of us in the job placement business, that when you're working with employers and companies, you have to have a supportive work environment if you're placing folks with disabilities, or anybody who needs any kind of accommodation or specialized approach, what have you. Cognitive training has shown some value in helping folks really kind of get, work on their thinking strategies, processing, all of those things. In vocational rehab, by the time folks are referred to us and are ready to really focus on an employment goal, we're thinking more of an emphasis on compensatory strategies versus that sort of restorative approach, simply because, well, there's a cost issue involved, and also restorative. I mean, you could participate in cognitive rehab for years and years and years because you may continue to see some incremental increases, but really, don't we want people to get out and start living their lives again as quickly as possible? That's what we all would want, I would think. And so the compensatory approach is, how can I live as fully and productively and independently as possible given the deficits that I may now have due to a brain injury? And that's sort of an approach that we look at in Virginia. And of course, assistive technology is becoming really huge, really important, and really beneficial. So that has to be something that is always considered, should always be included in an evaluation when we're looking at employment. There was a 2009 study that actually summarized 3 of the practices that showed, they called it weak support for these approaches. I would kind of argue that and say I think there's a little bit more than weak support, but I didn't do the research. So one of the approaches is support employment. That's something that's very close to my heart. I was one of the first job coaches in the country, and it's a very simple, intuitive idea that works wonderfully. It's one-to-one assistance throughout the entire employment process. The other thing that also seems intuitive and that we know anecdotally is very, very effective is case coordination or case management. To have one person kind of being the person that oversees and coordinates all services, including employment, I think is just invaluable, very effective, very beneficial. And then the third one that was recommended in this 2009 study was a program-based vocational rehab approach, and that was looking at a very structured, kind of several weeks, if you will, approach where people come in and get group training, learn how to build resumes. They might use videotaping to help people improve or enhance their job interviewing skills and things like that. For example, there's a program at Mount Sinai that is been shown to be very effective. again, there's a cost issue involved, and not everybody is going to be fortunate enough to be able to access a program like that. So moving on, when we talk about the vocational rehab process, and this is specific to the federal and state vocational rehabilitation program that is present in every state. There's an agency in every state that is responsible for employment services. Number one, does the individual with the brain injury want the assistance? Do they want to work? You cannot rely on the family's insistence that the person wants to work. And we've run into that time and time again. And certainly in vocational rehab, if the person wants the family members involved, that's fine, that's terrific, that's, we will honor that. But we do not meet with the family. We do not, without the individual with a brain injury or with disability. The request has to really be from the individual with the disability to say, yes, I want to work, I want to return to work, or I want to get a job. Otherwise, it's not going to work. We've seen that time and time again. Then, of course, determining eligibility for services. This is, again, specific to the vocational rehab program. The person has to have a documented disability, and that disability has to be a barrier to employment. There are many folks who have disabilities, and they may have a disability due to brain injury that, though, does not present a significant barrier to employment or any barrier to employment, and that is an eligibility requirement. And then we also look at financial need. There's a financial needs test if there will be cost services involved. We do provide counseling and guidance and other types of job placement services, but if training's involved or the purchase of technology and so forth, then we have to look at the financial status of the person. Also, in working with folks with brain injury, we look at, and you heard this, I'm sure, in Dr. Zasler's presentation, is the individual medically and psychologically stable? Are they able to focus on an employment goal? So we really need to know that the physician or whoever is kind of overseeing that person's medical and psychological care has released the person as being ready to or able to focus on an employment goal. If somebody is still receiving rather intensive medical treatment and intervention or therapy, then it might not be the best time to refer to vocational rehab. If you can see when the person will be stable or will be completing rehab, then I would say yes, go ahead and refer the person to your vocational rehab counselor. And really, you can consult with the VR staff at any time. I have heard, and I only include this because I've heard this from folks who've called me up and said, well, the person, or I was told that my recovery, most of my recovery would occur in 2 years, and so they said that I shouldn't come to VR any sooner than 2 years after my injury. That's absolutely not true. That is a rule of thumb that the most significant recovery does take place in the first 2 years, but that doesn't mean that you wait to access VR services. It's really dependent on, is the person medically stable and psychologically stable or emotionally stable. If they're participating heavily in therapies 2, 3, 4 times a week, then that may not be the best time to pursue employment because they're not really going to be able to pursue employment till they're done with therapy. And then one of the first considerations, it would seem, would be, can the individual return to the same job that he or she had at the time of their injury if they were employed, or do they have to consider looking for a new job based on, there's a change in the person's abilities and capacities, their strengths and their challenges. And so that has to be assessed, and then an employment goal has to be developed in conjunction with the person with a disability and the vocational rehab counselor or the job placement counselor, whoever's providing that service. So that's kind of one of the first things you need to determine. We have had experience with many folks and wonderful employers, saying, oh, this person can come back and we'll let them work part-time, or we'll give them, we'll ease up on some of their job duties, and it'll all work out. It'll be great. And very often it does not work out. And it can be very frustrating for the employer. It can be very frustrating for the individual with a brain injury and his or her family. On the other hand, it's also perhaps, a good learning experience, because the individual who has sustained the injury will become a little bit more aware of his or her deficits and maybe become a little more realistic about what they're able to do post-injury. So there's that to consider. I know that Dr. Zasler did review these, the effects of brain injury, but I'm just going to kind of go over these very quickly, because I think these are kind of the, the categories or areas that you want to look at when you're considering return to work. So medical issues certainly is a major thing to look at, as we mentioned a little bit earlier, and physical. If the person is still receiving physical therapy or occupational therapy, need to figure out how that can assist in employment, and certainly I think most therapists nowadays will look at daily living and what type of job maybe somebody is returning to, or just trying to get somebody to be as functional as possible. And then cognitive intellectual, we'll go into that in a little bit more detail, and the emotional behavioral, which really is probably one of the biggest issues that we need to look at and address when returning to work for folks with brain injury. So where do you start? It can seem rather overwhelming. Brain injury is very complicated and complex often. One size does not fit all. We said that already. And so it's kind of like, well, where do you start? How do we figure out what works and what are we going to do? So I always promote the use of a support team approach. That's a little more challenging and difficult to implement within the VR system, simply because counselors carry huge caseloads. And so taking the helm of a employment support team can be a little daunting. But if you have someone who has very complex, multiple needs, then this really is the way to go, in my opinion. And I really promote that. Because really, it does take a village, doesn't it? So we need to put a team together to help support the person to assure continued success on the job. Assessment is very important, and I know that most people will agree with that. One of the things that you want to do is to make sure that there is a recent neuropsychological evaluation, that it's comprehensive. I also am a big proponent of real-life assessments whenever possible. You know, the testing is really important. It should be work-related or vocationally related. And the counselor or whomever is requesting the testing should be very specific with the psychologist or the neuropsychologist. This is what I'm looking for. I need some vocational recommendations. I want this to be a vocationally oriented assessment. And there's literature out there. In fact, Dr. Jeffrey Kreutzer here at Virginia Commonwealth University has done a lot of work in that area and has guidelines for counselors and others who may be a little bit shy about asking for what they need, but you really need to be specific. Psychologists like that. Then they know exactly what tests they should be, will be most beneficial and so forth. So, okay, we can move on to the next one. I touched a little bit on strategies should be compensatory in nature, not restorative, but also that an individual has to buy into the use of any compensatory strategy or it will not be effective. You can come up with the greatest, iPad app in the world and say, hey, this is going to change your life, it's going to help you track your meds or whatever, your calendar function. If the person is not into it and it doesn't meet his or her needs or his or her lifestyle, then it's no good, no matter how great you think it is. So the person has to be involved in identifying, developing, and implementing any compensatory strategies. But in my opinion, this is the way to go versus the more kind of restorative approach, which kind of puts things on hold. If you're taking a restorative approach, you tend to have a mindset of, let's keep doing this cognitive training and see how much better, see where we can get this person in terms of enhanced cognitive functioning and daily functioning, and that job placement kind of gets pushed, to the back burner. And if you think about it, going back to work, and that's cognitive therapy right there. You're using your brain, you're making decisions, you're active, you're working, and so that's what I would recommend, compensatory versus restorative, when we're really focusing, trying to get back to work. And I guess just in summary on this section, I would say, to me, it's all about support and a good job match. Those are just very, very critical. If you don't have a good job match, just take your time, find the proper job match. The hallmark of a good job placement person is that they will turn down an available job because it's not a good job match. So it's about finding just that right fit that will really enhance success. Okay, so kind of going back to those categories when you're helping someone return to work, these are the things that we need to consider. Is the person medically stable? Has a physician released the person for employment? That would be sort of the number one thing. Are they able to, based on the medications that they might be taking, the fatigue levels, all of that. You need to get kind of a medical picture, a medical release to see where the person is at, because that'll help guide your job development activities. And if the person is receiving follow-along care by a physiatrist, and that's a Dr. Zasler who just presented. He's a doctor who specializes in rehab medicine, and often they kind of will be overseeing all of the sort of medically oriented care. They have to be included as a part of the team, if not head of the team. They're probably not going to call the support team together, but you darn well better make sure that he or she is available to participate on the team, or at least share updates and reports, as appropriate. We talked about the medications, because typically after a traumatic brain injury, there are a lot of medications that may or may not be prescribed. For one thing, a lot of doctors are still automatically prescribing anti-seizure medication, and that's something that should be looked at and evaluated, because that medication can have an effect on someone's cognitive processing and cognitive abilities. If it's not really needed, I've seen people who've been on anti-seizure medication for 10, 15 years, and they have never had a seizure. So it may be time to maybe try to wean them off under a doctor's care, of course, and see what the likelihood of seizure activity is, because it can really have some side effects that will affect employment negatively. The other things that we're going to look at in terms of medical issues that will affect job placement and the direction in which it goes: fatigue, headaches, and pain. Those all will affect job performance and the ability of someone to carry out all of the work duties in certain positions. So if somebody is still suffering from these medical side effects of a traumatic brain injury, you may have to look at perhaps part-time work to start out with, because they're simply not going to be able to work 40 hours a week or an 8-hour day. And you may have to look at just some other accommodations that you might be able to work out with the employer. Another area, of course, that's very important to consider is the physical. Is the person still receiving outpatient medical therapies? And if so, what are the therapies and what are the goals? How do they, are you in contact with the therapists, and are you working together as a team again? Usually there are medical teams that staff within a hospital or rehab setting, but if you are an employment specialist or job development or VR, can you be a part of that team? Because it's very important that everybody's sort of focusing on the same goals for the individual. What is the prognosis, and how much healing or recovery is expected? I think physical therapists can, and occupational therapists and speech therapists can project fairly well how much recovery somebody is going to have, and that's certainly going to guide, again, your job development activities for the individual. So I put in here again the real life evaluations. You know, how does somebody do if you take them out to lunch, out to McDonald's, and you can assess their speech when they're trying to order things, how do they interact socially, and so forth. And what about assistive technology, augmentative communication, orthotics? All of those have to be considered and put into place if a person needs them as you are focusing on employment. Now, cognitively and intellectually, this is probably one of the biggest areas that people, immediately jump to when they think traumatic brain injury. Oh, the person is going to be affected cognitively, and that is true. However, one of the hallmarks of brain injury is that the individual may score lower on certain tests of intelligence, but not across all of the scales. So that it's very important to find out where the strengths are and where there might be some weaknesses that can be accommodated or just considered during the job development process. There is a rule of thumb that the higher the ability that someone has pre-injury, then the better the outcome will be post-injury. And that's just something that we know. Again, it's a rule of thumb. The more you have, the more ability you have going into it, the better you're going to do post-injury. Just because there's more reserves there, there's more to draw from, and so forth. So mental processing might be slower, and it may not be as accurate. Those are things you need to take into consideration. Again, it's not across the board. It's not for everybody. It doesn't affect everyone the same way. So that's why it's really, really important to get a good neuropsychological assessment that will show you and explain to you and to the individual and his or her family the specific areas and what can be done to maybe compensate for those deficits. Concentration may decrease and distractibility increase. That would certainly, in my opinion, be very important to understand if someone is affected in that way when you're looking for a job match. Again, it's about the job match. So you wouldn't want to put somebody in a very, very busy environment, say the cafeteria here at VCU, maybe punching cards. It would just be too overwhelming, too distractible. So you have to really tailor your job development to what the person's abilities are and what their issues might be so that you can kind of ameliorate those. Memory problems are probably the biggest, most significant challenge that we run across when working with folks with brain injury. And it affects not only how you're going to place somebody in a job or how they're going to perform in a job, but how they function on a daily basis. And that's where the compensatory strategies really, really come into play. And a good compensatory strategy, two things about that. One is it's very effective in the employment setting. In fact, we've had employers say, wow, this is a great idea. You've labeled these areas, and so all of my employees are doing a better job or they're doing it faster. So that's a good sales point when you're working on a job site with an employer, with an individual with a disability, whatever the disability. And also, you need to use the same or similar strategies on the job site as you do at home and vice versa. So there should be continuity and consistency across environments. I think that's really, really key. Emotional and behavioral issues after brain injury, very, very challenging. And this is probably the biggest thing. People do not fail on jobs because typically they don't fail because they can't learn a job or they can't perform the job. But what we've seen is that it's the emotional and behavioral challenges that occur on a job site that really present the largest barrier to maintaining employment. There may be emotional instability. People can become become angry very quickly and lash out. They may curse. And again, this isn't everybody. I don't mean to stereotype, but we've seen that many individuals, especially if you consider that individuals, the majority of individuals, or the biggest group of individuals to sustain traumatic brain injury are young males and who engage in risky behavior. So it kind of stands to reason then that some of the issues that you're going to see behaviorally and emotionally are going to be somewhat radical. Inappropriate social behavior. We've seen a lot of inappropriate sexual behavior. You have young guys who see women on the job site and may say things or just act inappropriately. That's been something that we've had to deal with, and you may have to deal with as well, and intervene. And also just the losing your temper. There are just certain things that you can't do on a job site. And most of us have that filter that we may feel angry inside, but we can control it and take it out on our husband when we get home, or kick the dog or whatever. So again, where to start when return to work for folks with brain injury? A team approach it's never a bad idea to put a team together. It's always a good option, in my opinion. It's really the best option. I think it's a best practice or a promising practice. It's good to have everybody in the same room, saying, hearing the same things, agreeing on what the plan of action is. It's very good for the family members and for the individual to be able to refer back and say, do you remember we all agreed we were going to do X, Y, Z, and so forth. And also, it's just, I think psychologically, I think it's kind of a wonderful thing to think, wow, all these people are here in this team meeting for me, to support me, to help me return to work and help me really function as independently as I can. I think that has a really positive effect. I think it's really critical. Definitely have to have a very recent, I would say within 2 years. If it's a new injury, it may not be, you've probably had some neuropsych assessments done, but if you have someone who's referred to you who's longer term or longer post-injury, then I would say if you haven't had one done in 2 years, then probably a good idea to get an updated neuropsych assessment, because people do continue to change and improve over time. 15, 20, 30 years later. So I think that's very important. To get a good neuropsych assessment that is vocationally oriented. Make sure you ask those specific questions. And I also really believe in real-life evaluations. One of the things that we're doing here in Virginia for folks with brain injury, we have developed 6 clubhouse model programs, and within the clubhouse model, it's a supportive, therapeutic peer environment based on a work-ordered day, and some of the clubhouses have developed what we call employee development services. So you can get some in-depth assessment of an individual's ability to function in a work-ordered or a vocational environment. It's not a competitive vocational environment. For more than a couple of hours or more than a couple of days, our counselors can order this service, this evaluation service. It's 30 days. And so the honeymoon period is over after a couple of days, and you really will get a good picture of someone's ability to interact socially, to take direction, to interact with supervisors, to carry out specific job duties, work tasks, and it's worked out very well. It's still fairly new in Virginia, but we're pretty pleased with the results, and the counselors have been very happy with it. And it's very reasonably priced. It's on a per diem or a daily rate. So if you want more information on that, I can make that information available to you. And I also just think that the compensatory strategies and the supports, again, are really keys to success. So you need to evaluate in conjunction with the individual, where are you having problems? Is it a memory issue? Is it a behavioral issue? Let's put some strategies in place, and we're going to provide the support that you need to function better on a daily basis, which of course means that you will function better in your job. So again, I'm going to, I keep repeating, but it's very important. It's all about the job match. It really is. A good job match just can mean everything. A bad job match, it's not going to last, no matter how much it pays or where it is, if you think it has prestige, or if it's not a good job match for that person and his or her abilities, it's not going to last. And again, then the support of a team. I already mentioned the assessment, that it should be within the last 2 years. And again, summarizing, evaluate someone's status medically, physically, cognitive, intellectual, and emotional behavioral. Those are the major areas that you would look at. And also consult with and add to your support team as needed. It may be the physician, the physiatrist, the rehab doc, therapist, OT, PT, SLP, speech language pathologist, psychologist if you have someone who's providing ongoing services, a behavior specialist if an individual needs to have specialized behavior interventions such as positive behavior support, and of course the job coach, and the vocational rehab counselor. So the assessment, the vocational evaluation or situational assessment, again, I really promote the real life assessments because I think you'll really get much more valid information than just doing sort of paper and pencil tests or even just neuropsych tests. I think those are good adjunct information to have, but really the rubber hits the road when you have somebody in an environment that is either the same or similar to an environment in which he or she will be expected to perform job duties. And that means that there might be a lot of people around, there might be a lot of different things that are coming up, and so forth. And you'll see how somebody is able to react. I talked about how the VR counselor or employment specialist should request a vocationally related report when you're getting a neuropsych assessment. Remember, you're paying for it. You're paying for a service from this psychologist or neuropsychologist. So, get what you need from that psychologist. They would prefer that you are more specific rather than less specific when asking for an assessment. And also, one of the things that we do kind of promote in Virginia is the availability of life skills training. We in Virginia call it's community support services through the Vocational Rehab Agency. And if someone is not doing well outside of the work setting, it will affect their employment success. So it really, especially early on, it may be when determining eligibility, can a person function better and do better if they have some life skills training. It's really based on the whole support employment model. You intervene, you try to introduce strategies, training, and then you fade, and so the person can function more independently. And those things work very well together, in my opinion. Again, talking about the strategies that may come from a life skills or community support services provider, consumer participation and direction that really are critical in implementing these strategies. And are there any medical or neuropsychological strategies that a good neuropsych assessment will come with at least a page, the sort of the conclusions and then the recommendations. And they should be listing some strategies that would be helpful to help address or ameliorate the person's deficits following a brain injury. And you have to find out, is behavior consultation needed? And if so, what is that person's philosophy? There really should be a circle of support or this, team approach. Positive behavior support is kind of the way to go, in my opinion, because that does involve the support team. The community living assessment, that goes back to the life skills training or what we call community support services. What strategies are needed? What can be put into place at home, well, in all community settings actually, at home, in the community, at work, you know, the person may know what is going to work well for them. I mean, they will know. The family might have recommendations, and so you need to listen to them because they have been with the person day in and day out. And so if they have certain approaches and ways that have worked well, then let's check that out. Let's see if that'll work well across these environments. Basically, it only works if it works. It can be, again, the greatest idea in the world, and you think it's very clever and wonderful, but if the person doesn't like it, or if it doesn't work for that individual or that environment, then it's not going to work. So when we talk specifically about employment support or support on the job site, supported employment really is the ideal. It involves this individualized, we said earlier, every brain injury is different. Brain injury can be very challenging in terms of return to work and job placement. So it makes sense that supported employment, which is a one-to-one individualized approach, would be very beneficial. It's individualized job placement, on-site job training, and long-term follow-along, which is really, really critical. And employers love it. They feel like there's a partnership there, that they're not going to be left in the lurch if something happens. The person's long-term employment success is going to be much higher if you use this one-on-one long-term support approach. And I know in many instances there isn't funding for the long-term follow-along piece, which is needed. So at a minimum, at least upfront job coach training services, which vocational rehab counselors can purchase. Again, in Virginia, talking about the clubhouse model of services, the clubhouse can actually provide that long-term follow-up support. So supported employment from a clubhouse setting is being implemented in Virginia, and we're waiting to see how that works. We've had our first 2 clubhouses out of 6 have been approved as vendors of supported employment services, and I believe there have been a couple of placements, and we're kind of following that to see how that all works out. But it certainly makes sense to me intuitively that it would work great. Employment specialist is part of the team, if not the head of the team. Again, I know that's putting a lot on a person, just as it would be with the VR counselor. So somehow if you do put together an employment support team, which I do recommend, particularly for challenging cases, then you need to figure out who's going to be sort of the coordinator of that. And not everybody has a case manager, and you know, it may be something that you kind of rotate the leadership, who calls the meetings, who coordinates them. You know, it can be worked out. You just need to be creative. We talked about the life skills training can be critical, and that the strategies should be used across all environments for the individual. I've said this several times, the job match, very important. The work environment, I talked about that, you know, the distractibility issues, the slower processing. So exactly, you know, someone may say, well, this is the type of work that I like, that I want. But if you can do some real-life assessments and see that being in a busy, loud environment is not a good thing, or the fatigue issue may kick in. You know, until you're out there doing the work tasks, you may not really understand your own strengths and maybe some of your own challenges. And so the assessments, the situational assessments are good. And then, as I said, in Virginia, we're doing employee development services. Which is a more in-depth kind of a assessment. One of the things I had become aware of, an individual who did not handle interruptions very well, got very upset, very distracted, and actually pretty irritable. So why would you then place somebody in a job as a receptionist in which interruptions are inherent? That's what a receptionist does. He or she takes phone calls, handles people that walk up to the desk, but that's exactly what happened. Someone who did not handle interruptions well was placed in a receptionist job. And one of the solutions that they had was to put a sign up saying, please do not interrupt me. I'm sorry, I don't think that really was a good strategy. What I think is that was a poor job match, and that was not going to turn out well. I haven't followed up with that, but I can almost guarantee you it's been about 2 or 3 years later that that person is probably not working in that position. So again, that's just an example. Another one, if an individual has very poor hygiene, what is your solution to job development? Do you find a job where the odor would not be noticed, like maybe, I don't know, working, unloading a truck or something like that? Or would you work with the person to improve his or her hygiene using life skills training? Or would you do both? So those are questions that you need to consider and ask when you're trying to arrive at a good job match. So where to end? And that may mean where to end this presentation and where to end your job development and your return to work. It may end for the rehab specialist when you find a good job match and a successful placement. But for the person with a brain injury, there is no end. That brain injury does not go away. He or she has to live with the brain injury and the effects of that brain injury for the rest of his or her life. And actually there's more research now that showing that as people with brain injuries age, that they may experience higher rates of dementia if they were if they were prone to that to begin with. So we're still learning more about what happens as people are aging with a brain injury. Best practice would be to reassess all of these areas on an ongoing basis. As we said, individuals continue to improve over time. And again, yes, the 2-year rule of thumb, you do probably make the most significant recovery in those first 2 years, but you still will improve many years down the road. That doesn't stop. And someone who is active cognitively, physically, and is working in a job that he or she likes and is good at and is contributing is going to do a lot better than someone who's not. And then if somebody is currently employed, if their case has been closed, then and there are issues that come up, there are problems, there's a risk of the person losing the job, you can refer back to your vocational rehab agency, and the counselor can provide post-employment support or even reopen a case. So I just want to put that out there that if they're already working, people say, oh, well, I can't go back to VR because they're already in a job. But if there is a lot of evidence that the person is at high risk for losing the job, then you can go back and talk to the counselor and see what can be done. And we always kind of talk about, well, what is success in return to work and employment? We have to look at employment in the context of a person's life. It's not a separate event that begins and ends. It's actually for all of us. It can be a career. It's a very important part of our lives, and many people gain a whole lot of their identity from employment. So, it's important that somebody is feeling like they are participating in meaningful activity, that they're contributing to society, and it's not just something that begins and ends. It's going to change over time. We know that the person's abilities and interests may change, the work site may change, and we need to be sensitive to that and open to that. Also, individuals with fairly significant deficits due to brain injury will need long-term support, not just in employment. So you have to constantly reassess how are things going outside of the job. And a good follow-along job coach will be really aware of that and assess for that. Because if things are going bad at home or in other areas of the person's life, it's going to affect their work at some point. So if there's substance abuse, for example, or domestic issues, things like that, it's going to affect their employment. There's no question of that. And again, a team approach. If you have a whole lot of people who are on this person's team across all of these different environments, it could be church and work and maybe some hobbies, the family, friends, neighbors, what have you, this is going to really be the key to helping keep somebody functioning the best that they can on a daily basis in their lives and on their job. So I think we do need to redefine success, and sometimes it's not just come to the vocational rehab agency and we're going to try and place this person in a job and then that's the end of it. Often we have seen that people they go through several jobs before really they kind of can figure out what is a good fit for them, what they really like, and how they can be successful in employment. And it's a growth thing. A lot of the guys that we work with, and of course women too, maybe they don't have a really wonderful work history. It may not be very long. Some people have not worked. And so it's all a learning process. Learning, they might think, well, I think I would like to work in this area or this type of job, but then when you get there, they're not too keen on it anymore. So, there's that to consider. And I think we have to be a little more forgiving about this learning process and helping people get through that. One of the things I ran across, Dr. Rick Parente, who's at Towson University in Maryland. He did a small study, and he showed that people who had access to social support and supported employment, those were the two best indicators of successful employment. So, what more can you say? That's kind of what this whole presentation has been about. The team approach, the social support is so critical. He also talks about nutrition, by the way, and how important that is to help somebody's cognitive abilities and cognitive functioning. That nutrition, exercise, all that stuff that we always hear about, very, very important, however. But his study showed access to social support and support employment. I was real happy to hear that because I agree with that. And here's my contact information. I'm happy to make available the references, the citations on some of the research that I cited, information on the clubhouse model for people with brain injury in Virginia that we've been developing, and just any other information or questions that you might have. So thank you very much. I always appreciate the opportunity to talk about this topic that I find very interesting and I'm very passionate about. So thank you.